Hi, this is Dr. O with NCLEX Bootcamp. Today we're covering diuretics. These are the go-to medications for getting rid of excess fluid. Let's start with the basics. Diuretics are medications that diurese, which means they remove excess fluid from the body by increasing urine output, which helps manage conditions where we have too much fluid, like hypertension and fluid overload, like what we see in heart failure. Now, diuretics do this by increasing renal excretion of sodium. Now, this happens at different points along the nephron, depending on the medication class, but the end result is the same, being that water follows the sodium, thereby increasing urine output, which decreases fluid within the body. Now, as fluid is lost through the urine, circulating blood volume decreases, which lowers blood pressure and decreases cardiac workload. Sounds great, right? Well, mostly, but remember, we're causing a loss of fluid and we're altering electrolytes, which can cause some unwanted side effects. The three big ones are dehydration, electrolyte disturbances. Specifically, we worry about potassium because, as you might remember, diuretics can be either potassium wasting or potassium sparing. And third, we have increased urinary frequency. So let's take a closer look. So we can see here that those three side effects show up in our big picture considerations that apply to all diuretics. The first is dehydration. This is because the more fluid that we push out of the body, the higher the risk for dehydration becomes. So we monitor for signs of dehydration like oliguria, confusion, and rapid weight loss, as well as things like dry mucous membranes, poor skin turgor, and low blood pressure. And of course, tracking daily weights is one of the best ways to track fluid status. Now, fluid loss lowers circulating blood volume, which brings us to our next risk of orthostatic hypotension. And that's why client teaching is key here. We teach clients to change positions slowly to avoid dizziness and falls. Our second big concern is electrolyte disturbances. And we especially worry about potassium when it comes to diuretic use. This is because diuretics are classified into two categories. We have our potassium wasting diuretics, which cause potassium loss, and our potassium sparing diuretics, which cause potassium to be retained. So depending on the diuretic, potassium levels can drop too low or rise too high. And we know that alterations in potassium can lead to dangerous cardiac dysrhythmias. This is why it is so important to monitor labs closely and watch for red flag symptoms of potassium abnormalities like irregular pulse, muscle cramping, or muscle weakness. And our third big concern is increased urinary frequency. Now, diuretics increase urine output, so clients will naturally need to void more often, and this is a normal finding. But the timing of administration really matters here. So if the NCLEX asks, we teach clients to take diuretics in the morning to prevent nocturia, because fewer nighttime bathroom trips means a lower fall risk, especially in older adults. And remember, the NCLEX is a safety-focused exam, so fall prevention is always a big priority. All right, it's time for our first NCLEX quick check. Take a minute to pause and see if you can answer. All right, first up. To reduce the risk of falls in clients who are taking a diuretic, clients should be taught to do what? Remember, we teach clients to change positions slowly. This is because diuretics decrease blood volume, which increases risk for dizziness and falls if clients stand up or change positions too quickly. Next up, what time of day should diuretics be administered? Remember, we teach clients to take diuretics in the morning because giving diuretics too close to bedtime will cause a need for increased urination throughout the night, which significantly increases fall risk, especially in older adults. Okay, now let's take a closer look at our individual classes of diuretics, starting with our potassium wasting diuretics, which include our loop and thiazide diuretics. Starting off with our thiazide diuretics, the most common example here is hydrochlorothiazide. Now, like all diuretics, thiazides can reduce renal perfusion if too much fluid is lost. Because if too much fluid is lost, we have less circulating blood volume, which leads to reduced kidney perfusion. So we monitor kidney function by keeping an eye on BUN and creatinine levels. Now remember, thiazide diuretics are potassium wasting. So we need to watch for and immediately report any signs of hypokalemia because low potassium increases the risk for dangerous cardiac dysrhythmias. So we need to recognize early warning signs like an irregular pulse, flattened T waves if we're looking at an ECG, and muscle cramping. Now, to prevent hypokalemia, we encourage intake of potassium-rich foods. So foods like bananas, oranges, raisins, and potatoes can all come to the rescue here and are excellent choices if the NCLEX asks you to select meal options. We also need to keep in mind that thiazide diuretics can increase blood glucose. Now, you might be wondering what thiazide diuretics have to do with blood glucose. Well, this happens because low potassium interferes with insulin release from the pancreas. And less insulin means glucose stays in the bloodstream, leading to higher blood glucose levels. And this can make blood glucose more difficult to control in our diabetic clients, so it's important to monitor blood glucose levels really closely in clients with diabetes. Next up, we have our loop diuretics, which are also potassium wasting. And examples here include bumetanide, torsemide, and of course furosemide, which is Lasix and probably one of the most common examples you'll see on the NCLEX. Now, these are powerful diuretics, so they come with some important safety considerations. Again, all diuretics can reduce renal perfusion because of the fluid loss that they cause. So we continue to keep a close eye on kidney function by monitoring labs like BUN and creatinine. Now again, loop diuretics are potassium wasting. So hypokalemia is the big side effect we need to watch out for because remember, low potassium puts clients at risk for dangerous cardiac dysrhythmias. So red flags to look for include, again, an irregular pulse, flattened T waves, if we're looking at this on an ECG, and muscle cramping. Now, to prevent hypokalemia, we encourage potassium-rich foods. So if the NCLEX asks you to select food options, look for those bananas, oranges, raisins, and potatoes, just like we did for the thiazide diuretics. And finally, we have the risk for ototoxicity, because remember, rapid IV push of furosemide can cause hearing loss. So if the NCLEX asks, remember, IV furosemide must always be administered slowly, over 1 to 2 minutes. All right, now let's talk about our potassium-sparing diuretics. Remember, these are the diuretics that cause the body to retain potassium. Examples here include spironolactone, which is our most common example, and also triamterene, which we often see in combination with thiazide diuretics. Now, unlike thiazide and loop diuretics, which cause a loss of potassium, potassium-sparing diuretics, like spironolactone, cause the body to retain potassium. That means that our biggest safety concern here is hyperkalemia, or high potassium. This means we need to watch out for and immediately report symptoms of hyperkalemia, like an irregular pulse, peak T waves, if we're looking at this on an ECG, and muscle weakness. This is because elevated potassium can lead to life-threatening dysrhythmias. Now, because of this risk, we avoid potassium-sparing diuretics in clients with renal failure. This is because damaged kidneys can't get rid of potassium effectively, which significantly raises the risk for hyperkalemia. We also want to avoid combining potassium-sparing diuretics with other drugs that also increase potassium. This includes our ACE inhibitors, our angiotensin receptor blockers, and of course, potassium supplements. Now, client teaching is key here. We teach clients to avoid high potassium foods, which means clients need to stay away from foods like oranges, bananas, raisins, and potatoes. And if the NCLEX asks you what else these clients should be avoiding, look for salt substitutes because many of these contain potassium chloride. All right, it's time for our final NCLEX quick check. Take a minute to pause and see if you can answer. All right, first up, IV furosemide should be administered over how long? Remember, IV furosemide must be administered slowly over 1 to 2 minutes to reduce the risk of ototoxicity. Next up, what 2 diuretic classes are potassium wasting? That is going to be our thiazide and loop diuretics, which are potassium wasting, not to be confused with spironolactone, which is potassium sparing. And lastly, clients taking a potassium-sparing diuretic should avoid consuming what? Remember, with potassium-sparing diuretics, we want to reduce the risk for hyperkalemia or high potassium. So we want these clients to avoid potassium-rich foods like oranges, bananas, raisins, and potatoes, as well as salt substitutes because many of these contain high levels of potassium as well. All right, you are set to tackle diuretics on the NCLEX. Thank you so much for joining me.